Welcome back to The Deep Dive. Before we dive in, I just want to say if you enjoy these deep dives, head on over to the All Sorts Podcast YouTube channel where you can like and subscribe. We also have a ton of other deep dives in our library that you can listen to. And we'd love to hear from you on our social channels. So find us on X, Instagram, and Threads.
Today, we're going to be looking at methadone. We've got sources from government health websites, medical guidelines, and all that good stuff to really, give you a good picture of what methadone is.
Yeah. And so basically, we're just going to be going through all this information and trying to extract what's actually important. What do you really need to know about methadone? How is it used in treatment? How is it administered? What are the safety considerations? And what are the potential side effects? That kind of thing. We're not going to go super in-depth into the super technical, jargony stuff, but we're going to try to make it understandable for everyone.
Right.
So let's get started. So methadone, it's used to treat opioid dependence, and this can include heroin dependence.
Yeah. And it does that by helping to relieve those withdrawal symptoms. Those can be really, really difficult to deal with. And then, of course, to reduce those cravings, the cravings that lead people to relapse. What's interesting about methadone is that it has a very long half-life, meaning it hangs out in the body a lot longer than, say, a drug like heroin or fentanyl. So it can really help people stabilize. They don't get those peaks and valleys, the withdrawal, the cravings that happen with the shorter-acting opioids. And because of that, there's a lot of concern about diversion, because if it gets in the hands of someone who is not opioid tolerant, that respiratory depression can be pretty significant.
Yeah. Okay. So it's not just about getting you off of the drug. It's about stabilizing you so that you can get your life together, so to speak.
Exactly.
And that's where this methadone maintenance treatment comes in. And so this can actually be a long-term treatment.
Right.
Like months or years.
Exactly. And it often involves going to a clinic every day for your dose. So you have to go there every day to get your dose of methadone. Oh, wow.
Yeah. And the idea is, it reduces the use of illicit drugs. And, by doing that, it can help people address the social, financial, and family problems that they might have that are associated with their addiction.
Right.
So it's really trying to treat the whole person and not just the addiction.
Yeah, that's a really holistic approach. And what about, I know you were saying that in correctional facilities, that it's a big treatment to help prevent relapse.
Right. So in correctional facilities, it can have, pretty significant effects in terms of relapse prevention.
Okay.
For people who maybe aren't even physically dependent.
Oh, okay. Interesting. Okay. So we've talked about it in terms of opioid dependence. But methadone is not just used for opioid dependence, right? I know I've read about it in pain management as well.
Right. Methadone is also used for pain management, especially, in patients who've developed a tolerance to other opioids.
So their body has gotten used to the other opioids, and they need more and more. Methadone can be an alternative. And, this is for severe pain, like cancer pain or pain from neuropathy. Methadone's really interesting because it kind of binds to the opioid receptors in a different way than some of the other drugs. And it also has some action on what are called NMDA receptors, which are involved in nerve pain. So it can be really good for some of these chronic pain conditions.
Yeah. Okay. And it can even be used in children?
It can be used in children, again, for severe pain management. But we consider this off-label use.
Okay.
Meaning there haven't been, extensive studies done in children.
Right.
So it's something that we use with a lot of caution.
Yeah, that makes sense. Okay. So in terms of administering methadone, what forms does it come in? How is it administered?
So methadone comes in a lot of different forms. There are tablets. There's a concentrated syrup. There are dispersible tablets, meaning tablets you mix in liquid. It can also be given intramuscularly, IM, intravenously, IV, subcutaneously, sub-Q.
Wow.
Even epidurally, intrathecally.
Okay, that's a lot.
A lot of different ways to give it.
I'm assuming for the maintenance treatment, it's probably oral mostly.
Right. Yeah, oral is definitely the most common.
Okay.
The tablets, the syrup. But it can be given other ways. And for those dispersible tablets, it's important to note that you can't chew them or swallow them.
Right.
You have to mix them in at least 120 milliliters, which is about half a cup of water or orange juice, some kind of citrus drink.
Got it.
And you have to drink the whole mixture right away.
So no shortcuts?
No shortcuts.
Okay, got it. So when we were talking about like MMT, like how is the dosage determined?
So for MMT, they usually start you on a pretty low dose of methadone,
Okay.
and then they gradually increase it until you reach what's called a maintenance dose.
Ugh.
And the idea is that the maintenance dose will prevent withdrawal, prevent cravings,
Right.
but won't make you feel high, won't give you euphoria.
Okay.
So it's about finding that right level.
Yeah. Now, the dosing procedures in clinics are pretty strict. Like, why is that?
Yeah, there's a lot of concern about what's called diversion,
Okay.
which means, someone getting methadone who's not supposed to have it.
Got it.
And, as we talked about, if someone is not opioid tolerant, it can be very dangerous. So what they'll do is they'll, very carefully check your ID.
Right.
They'll see if you're intoxicated at all. They'll make sure you actually swallow the medication.
Oh, wow.
They'll watch you.
That's intense.
Yeah, and then after you take it, they'll usually have you wait like 15, 20 minutes.
Wow.
Just to make sure you don't, throw it up or
Okay.
something. And to make sure you're okay. And it's also important to know that if someone is on MMT in the community and then they go into a closed setting, like a hospital or correctional facility, their dose should be continued. It shouldn't be interrupted.
Oh.
Because, again, you don't want to cause withdrawal.
Yeah, that makes sense.
So it's really important that those protocols are followed.
Wow. Okay. So what about pain management? Like, how is dosing for pain management different?
So dosing for pain management is different. You have to really individualize the regimen.
Okay.
And you have to consider whether the patient is opioid naive,
Okay.
meaning they haven't been taking opioids regularly,
Mm-hmm.
or whether they're opioid tolerant,
Yeah.
meaning they've been on opioids.
Mm-hmm.
And if they're switching from other opioid pain medications, there are these conversion guidelines
Okay.
that can help determine what the starting methadone dose should be.
Right.
But it's really important to understand that these conversion guidelines, they're just a starting point. You really have to titrate the methadone dose, meaning adjust it up or down,
Got it.
to achieve pain relief, but also manage side effects.
Right.
And so you don't just rely on the calculation, you really have to see how the patient does.
It sounds like a much more like nuanced approach.
Much more nuanced.
Yeah. Are there any considerations like in general for methadone treatment?
Yeah, definitely. So patients who are on long-term MMT, they can actually develop a tolerance to the pain-relieving effects of opioids.
Oh, wow.
So if they need pain relief for, if they get injured or something,
Right.
they might need higher doses of other opioid analgesics
Okay.
than someone who's not on methadone.
Got it.
And then, of course, you always want to try non-opioid pain relievers first, if possible,
Right.
like, paracetamol or NSAIDs. And, this is really important. Methadone should never be abruptly discontinued
Right.
in someone who is physically dependent. Stopping it suddenly can cause very severe withdrawal symptoms. So you always want to taper the dose gradually under the supervision of a healthcare provider.
Got it. Okay. Yeah, that makes sense. All right. So now let's talk about safety and risks, because I know a lot of people probably think of that when they think about methadone. Like, is this going to be habit forming? Can you overdose?
Absolutely. So methadone, can be habit forming,
Mm-hmm.
which is why it's so important to take it exactly as prescribed.
Right.
And, never adjust your dose yourself. That can be really dangerous.
Right.
Overdose is a big concern, especially in a few situations. When someone's first starting on MMT
Okay.
and their body hasn't adjusted to it yet,
Mm-hmm.
if methadone is combined with other CNS depressants,
Okay.
like alcohol or benzodiazepines,
Right.
or if there's accidental ingestion, like a child gets into it or
Well,
something.
yeah, of course. Okay, so what are the symptoms of an overdose?
So the symptoms of a methadone overdose can include slowed or shallow breathing, slow heart rate, severe drowsiness, muscle weakness, cold, clammy skin, pinpoint pupils, meaning the pupils get really small, and fainting. And unfortunately, overdoses can lead to coma and death.
Right.
And the other thing that's really important to know is that sometimes the signs of a methadone overdose might not be obvious for 3 or 4 hours after you take it.
Oh, wow.
So, it's not always immediately apparent.
Yeah, that's worrisome.
Right. So it's really important to be aware of those risks.
Yeah. Okay, so what about just like at home? Like, how should it be stored? What are the precautions?
So you want to keep methadone out of reach of children and pets at all times.
Right.
Store it in the original container, tightly sealed at room temperature, away from heat and moisture.
Okay.
And then when you're done with it, you're not using it anymore. You want to dispose of it safely.
Right.
talk to your pharmacist or doctor about how to do that properly.
Okay, yeah. Okay. So beyond just the risk of overdose, like, what other safety concerns are there with methadone? I know drug interactions are always something to be mindful of with any kind of medication.
Yeah, drug interactions are huge.
Yeah.
So methadone can interact with tons of other medications. I'm talking prescription drugs, over-the-counter drugs, herbal supplements. And these interactions can increase the risk of all sorts of problems.
Like what?
Like breathing problems, sedation, even coma. And then there's this thing called QT prolongation, which we'll talk about in a minute.
Okay.
That's a heart rhythm problem.
Okay.
So, it's really important to tell your doctor and your pharmacist about all the medications you're taking.
Right.
Not just the prescription ones, everything.
Okay.
Even if you've recently stopped taking something.
Got it.
Like in the past 2 weeks or so.
Okay.
And, there are some specific drug interactions I want to mention because they're really dangerous. MAO inhibitors.
Okay.
Like isocarbachazid or linezolid. Herbal products like St. John's wort. If you combine methadone with other opioids or alcohol or drugs that can cause drowsiness,
Right.
you're really increasing your risk of a fatal overdose.
Okay.
And then there are a lot of drugs that can interact with methadone in terms of sedation in this QT interval. So like dexmedetomidine, fluvoxamine, formoterol, some antipsychotics, some antibiotics. I mean, the list goes on and on.
Wow. Okay.
So there's a lot of potential for interaction there.
Yeah. So QT prolongation, what exactly is that? Like, break that down for me.
Okay. So think of your heart. Your heart has an electrical system that makes it beat.
Right.
And after every heartbeat, there's this little pause where the electrical system kind of recharges.
Yeah.
QT prolongation is when that recharging takes longer than it should.
Okay.
And that can cause the heart to beat irregularly.
Got it.
And that can lead to fainting, seizures, or even sudden death.
Wow.
Methadone is one of the drugs that can cause QT prolongation. So, we got to be careful with that.
Yeah, of course. So who should be particularly careful about this?
So if you have a history of long QT syndrome,
Okay.
which is a genetic condition, or if you have a slow or irregular heartbeat already,
Okay.
or low potassium or magnesium, or if you have heart disease,
Okay.
those are all things that can make you more susceptible.
Right.
And then if you're taking methadone and you experience like pounding heartbeat, dizziness, lightheadedness, fainting, you got to get medical help right away.
Okay, got it.
Yeah.
Yeah, those are some pretty serious symptoms.
Yeah.
What about just like breathing problems or blood pressure? Like, are those issues?
Yeah. So there's a risk of slowed or shallow breathing and excessive sedation, especially in elderly patients,
Okay.
people who are very frail or malnourished
Okay.
or debilitated. And that risk is even higher if you're taking methadone with other CNS depressants,
Right.
like we were talking about before.
Yeah, okay.
Methadone can also cause low blood pressure,
Okay.
including orthostatic hypotension,
Okay.
which is when your blood pressure drops when you stand up.
Right.
So you get dizzy, you can even faint.
Got it.
So doctors need to monitor vital signs carefully,
Okay.
especially when someone's starting on methadone or if the dose is adjusted.
Yeah.
And we generally avoid using methadone in patients who are in shock.
Okay. That makes sense.
Yeah.
Now, what about, I know I saw some things about like GI issues and urinary issues as well.
Yeah. So if you take methadone with drugs that have anticholinergic effects, it can increase your risk of something called ileus, which is where your intestines basically stop working,
Oh, wow.
and urinary retention, which is when you can't pee.
Okay.
So doctors have to be mindful of that and monitor patients for those symptoms.
Okay, so what about people with like kidney or liver problems? Like, are there extra precautions?
Yeah, so in patients with kidney problems, we often have to lower the dose. And if someone has severe liver disease, we generally avoid using methadone because it can increase the risk of hepatic encephalopathy, which is a serious brain problem.
Okay, so a lot to be mindful of there.
Okay.
So pregnancy and breastfeeding, like, is methadone safe during pregnancy and breastfeeding? Like, what are the recommendations there?
So if a pregnant woman is opioid dependent, we usually recommend starting methadone maintenance treatment as soon as possible.
Okay.
It helps manage their opioid use disorder, and it prevents the risks of withdrawal during pregnancy, which can include things like miscarriage and premature birth.
Right.
And you may need to adjust the dose during the pregnancy, especially towards the end.
Okay.
Now, babies who are born to mothers on MMT, they may experience something called neonatal abstinence syndrome, NAS,
Okay.
which is basically a withdrawal syndrome in the baby.
Right.
And that needs to be managed by a specialist.
Okay, that sounds pretty challenging for both the mother and the baby.
It is.
Yeah. What about breastfeeding? Like, is it safe to breastfeed on methadone?
So methadone does get into breast milk,
Mm-hmm.
but the levels are usually pretty low and generally don't cause any problems for the baby.
Okay.
And, the benefits of breastfeeding usually outweigh the risks,
Mm-hmm.
but it's still important to watch the baby.
Okay.
Look for signs of increased drowsiness or breathing problems.
Right.
Just to be safe.
Yeah, of course.
And the other thing is that methadone can decrease fertility in men and women.
Oh, okay. So that's something to consider. Okay.
Right.
What about just the diversion of methadone? Like, how big of a problem is that?
Diversion is definitely a concern.
Yeah.
But good programs can minimize that risk
Okay.
by using those strict dosing procedures that we talked about.
Right.
Unfortunately, most methadone deaths actually occur in people who are not in opioid substitution therapy.
Oh, really?
Yeah, so they're getting the drug from somewhere else.
Wow.
It's diverted medication.
Okay.
So, this highlights the importance of being in a legitimate program.
Right.
And supervised consumption is really important.
Well, okay.
It's been shown to reduce mortality.
Wow. Okay.
So, being in a program, doing things the right way, that's really important.
Right. Yeah. Okay. Now, I think the big question on a lot of people's minds is, okay, what are the side effects? Like, what am I going to experience if I'm taking methadone?
Right.
What are the common ones?
So some of the common side effects are constipation, nausea, feeling tired, increased sweating, dry mouth, dizziness.
Okay.
The good news is that these often get better over time
Okay. Well, that's good.
as your body adjusts to the medication.
Sure.
But there are other side effects that can occur,
Mhm.
like agitation, angina pectoris, anticholinergic effects,
Right.
like dry mouth, palpitations, tachycardia,
Right.
bradycardia, cardiac arrest, coma, dizziness, dysphoria, euphoria, faintness.
Wow, that's a lot.
Yeah, mental clouding or depression, myocardial infarction,
Okay.
pruritus, urticaria, nervousness,
Mm-hmm.
the QT interval prolongation that we talked about. Right.
Respiratory arrest or depression, restlessness, sedation, seizures, severe cardiac arrhythmias, shock, ST segment elevation,
Okay.
sweating, flushing, warmth,
Mm-hmm.
difficulty urinating,
Okay.
and changes in sexual function.
Got it.
So, things like decreased libido, erectile dysfunction,
Mm-hmm.
irregular menstruation.
Yeah. Okay. Are there any side effects that, if you experience those, you really need to get medical attention right away?
Yeah, absolutely.
Okay.
So if you have seizures,
Mm-hmm.
if you have any kind of rash, hives, itching, swelling,
Uh-huh.
that could be an allergic reaction.
Right.
Extreme drowsiness,
Mm-hmm.
agitation, hallucinations, fever, sweating, confusion, fast heartbeat, shivering, muscle stiffness or twitching, loss of coordination, diarrhea.
Wow.
This could be something called serotonin syndrome,
Okay.
nausea, vomiting, loss of appetite with weakness or dizziness,
Okay.
inability to get or keep an erection, irregular menstruation, decreased sexual desire, difficulty urinating.
All of those things, you've got to get medical help right away.
Got it. Yeah.
Yeah.
Okay. So this has been a lot of information.
Yeah.
And I think, we've really gone through a lot of the key points here.
Right.
So what would you say are the most important takeaways about methadone for our listeners?
So methadone, it's a powerful medication,
Mm.
and it can be really helpful in treating opioid dependence and managing severe pain.
Right.
But because of the risks of dependence, overdose, and all those drug interactions,
Right.
you have to be really careful with it. You got to take it exactly as prescribed.
Right.
And you got to tell your doctor and pharmacist about all the other medications you're taking and any health conditions you have.
Yeah.
And, for opioid dependence, methadone maintenance treatment can be a long-term strategy to help people stabilize and reduce the harms of drug use.
Okay.
Now, there are side effects,
Mm-hmm.
but a lot of them can be managed, and often the risks of untreated opioid dependence are much greater.
Right. Okay. So it's really about weighing the benefits and the risks
Yeah.
and talking to your doctor.
Right, exactly.
Yeah. Okay. So, listener, as you've been listening to us talk about methadone, what stands out to you? What are your thoughts on this?
Yeah. And this kind of leads to a bigger question.
Mm-hmm.
How can we, as individuals and as a community,
Mm-hmm.
best support informed decision-making and access to appropriate treatments like methadone,
Yeah.
while also mitigating the risks?
Right.
That's a really important question to think about.
Yeah. And maybe checking out some resources from SAMHEA or other reputable sources might be a good place to start.
Definitely.
Yeah. Okay, well, that's going to do it for our deep dive on methadone. We hope this has given you a better understanding of this complex medication and its role in treatment. If you enjoyed this deep dive, be sure to like and subscribe to the All Sorts Podcast YouTube channel and check out our other deep dives in the library. And follow us on X, Instagram, and Threads to stay up to date on all things All Sorts Podcast.
Thanks for listening.
And we'll see you in the next deep dive.